Good evening. My name is Matthias Ledesma, and today I'm going to talk to you about becoming a bone marrow donor. Now, donating bone marrow is not as popular of a field, it's much newer, and it's a lot less involved than donating blood or your organs would be. Bone marrow is the spongy tissue on the end of the bones which produces your red and white blood cells as well as your platelets. And the reason why bone marrow is donated is because it helps fight cancerous blood diseases such as leukemia and lymphoma. Now, becoming a bone marrow donor is very, very easy. It just requires you to be committed and available when the time comes. Now, our own families may be healthy, but there may be some individuals who are not healthy and have one of these diseases, and you could be the match to help save a life. According to Be the Match, every 4 minutes, a person is diagnosed with a cancerous blood disease. That's 15 people an hour, 360 people a day. And at any one point, 7,500 patients are actively seeking an unrelated donor. Now, what happens is bone marrow donation is much more specific than blood. You can't be O positive or B negative. The tissue has to be exact. The proteins have to match up for the transplant to have any chance of success. Now, 3 out of 10 patients who need a bone marrow transplant are able to find it from a relative in their family. But what about the other 70%? They must turn to the National Registry, which only makes up about 2% of our population. And this is for many reasons. With bone marrow transplants, they look for people ages 18 to 44 because the people are healthier and we're more likely to have less complications in any surgery or any procedures. And at this time, people 18 to 44 are more selfish. We think about ourselves and our families, and we're not focused and we're not educated enough because it is a newer procedure than blood or organ donation. What's sad is as many as 3,000 patients will die this year because of lack of finding a donor, and many, many more because they only found a partial donor. Becoming a bone marrow donor is easy. First, the most important thing you have to do is register online at bethematch.org, and then you'll be asked to give a swab of the inside of your cheek so they can start analyzing your proteins and everything in your saliva so they can see where to match you in if you could be a possible match. Now, doctors then, they look for the matches on the National Registry for their patients, and you may be a possible match. Then they'll keep looking, they'll have a few possible matches, and you may or may not be matched to move on. But staying committed is extremely important in this process because you could save someone's life. If matched, and only 1 in 500 people actually move on to donate, there are several steps taken to ensure that the procedure is safe for both parties. Then the doctor will choose which procedure is best for the patient. 70% of donations are PBSC, or peripheral blood stem cell transplant, and the other 30% is the actual bone marrow donation. Now, PBSC is a non-surgical procedure in which the 5 days leading up to before your donation, you will get injected with filgrastim, which is a medication that increases blood forming cells in the bloodstream. And so what happens in the procedure is that they'll stick a needle, draw the blood, your stem cells will get filtered through the tube, and then they'll put the blood back into your arm. And your levels will get back in a month, and everything will be back to normal. Now, the second step is the actual bone marrow donation, which is a minor surgical procedure in which, under general anesthesia, so you're knocked out completely and you don't feel anything, they make a slight incision and the doctor sticks the needle right directly into the back of the pelvic bone and draws out the liquid bone marrow. And when they draw, you're only using maybe up to 5% of your bone marrow, so it's really not a lot and you don't feel it. We really can save lives, guys. Take John Stevens, for example. A college football player from New York was able to save Clara Boy's life. The day that John registered on Be the Match, his soon-to-be patient that he didn't know existed turned 17 days old. And at 4 months, Clara was diagnosed with acute myeloid leukemia, which is very high risk at that age. Also coupled with she had a fungal infection, and so she had very, very slim chance to survive. When John got the call, he did not hesitate to act and immediately booked his ticket to Wisconsin to do the procedure. His mom, Clara's mom, sent him in a letter saying that he was the perfect match. 10 out of 10. Every little thing, the proteins, the blood type, everything was perfect, almost as if they were related. Because the bone marrow grafted so well into her body, Clara was discharged within a month, which is unheard of in that situation. Bone marrow transplant patients are usually stay at least 100 days in the hospital before being released. The mom told him his blood clearly runs through her veins because she loves football. Now John, like so many of us, can give someone a second chance at life. As you can see, it's easy to become a bone marrow donor, but we must be committed. Some of you may not want to be donors, and that's okay, but we can still be a part of this cause both financially and with our time, so together we can all save lives. Khalil Gibran once said, "You give little when you give of your possessions. It is when you give of yourself that you truly give." Do not wait any longer. Go and join Be the Match registry at bethematch.org, and you can be the perfect match to save someone's life. Thank you.